So recently my friend asked me to accompany her to a GP visit, only because she said that the doctor always spoke like in medical terms, and she didn't fully understand what he was saying. I was skeptical at first because I'm like, it's going to be very weird if two of us are in the room. But anyway, I went with her and I accompanied her. And he basically told her that she has something called pernicious anemia. So at first she didn't understand what any of the terms meant. And then she said to me, please, can you just break it down for me when we're out of the doctor's office? Which was perfectly fine because I didn't want to disrespect the doctor either by talking while he was talking. So basically, she's had symptoms like fatigue. She's had nausea, vomiting. She's had tingling in her hands and feet. She's had pale skin. She's had most of your anemic type symptoms. So the symptoms basically mimic anemia, iron deficiency anemia. But what she didn't understand was that he said to her that it was an autoimmune condition. So basically what autoimmune means is that your body mistakenly, or your immune system mistakenly starts breaking down its own enzymes and organisms. In any case, she then said, okay, so he says I have pernicious anemia. What does this mean? And I said, basically, you just have a vitamin B12 deficiency. Vitamin B12 deficiency is caused when your immune system breaks down proteins called an intrinsic factor, which basically prevents or slows down the production of red blood cells. So iron deficiency anemia and I suppose B12 deficiency anemia are very closely tied together. But after our conversation, she understood better what pernicious anemia is. And now when she goes back to her doctor, she'll actually be able to understand why certain treatments are going to be given and what the way forward is. And she'll be able to understand and interpret that information better because now she has an almost layman's term explanation as to what's happening in her body. So if you have any of those symptoms, and if you don't understand what your doctor is saying because they speak medical lingo, ask them to stop, backtrack, and explain it to you as though you were a 5-year-old child, so that you can fully, and not because you're stupid, but so that you could fully understand the condition, the treatment, and the investigations that need to go hand in hand with the diagnosis. If you are one of those people, get to your doctor, consult, and get the best possible treatment so that you become a better version of yourself. Thanks.